Us now to talk about all this is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Thanks for being with us again.
Good morning.
Hey, good morning.
So let's talk about this vaccine update. Now, Pfizer speeding along the FDA approval. What does this mean for all of these vaccines and when people get them?
Right. Okay, great. This is part of Operation Warp Speed, and they are going at warp speed. It's really amazing how fast this is all coming about. We heard through press releases starting on the 9th of the month of the very promising results that these vaccines have, both the Moderna and the Pfizer. They're both RNA vaccines in the same family, and they've got enough information to apply for the EUA. That's the emergency use authorization that will allow them to start selling the drug. So they applied. The FDA wants this out there. They're going to review all the data, and really in a matter of days or weeks, they will get the approval and start distributing the drug.
But if normally they would test this thing for a year, I'm wondering, what are you hearing from your colleagues who will be the first to get them? Are they willing to take them?
We're in a pandemic, so we are not going to play by the regular rules. We've got patients who took this vaccine almost 6 months ago. The development started in February, and they had the phase 1. So there's a sentinel group of people out there that have many months' experience. So the data is going to be looked at very closely by the FDA and by external groups. Multiple external groups will also look at the data. They have to be transparent because they got to sell me first. Because if I get up here or any other expert in the field and says, I don't believe in this, nobody's going to take it.
A lot of people, oh, sorry.
Go ahead.
Yeah, I keep interrupting. A lot of people keep reaching out about college kids coming home, and much like with the Thanksgiving holiday, what do you tell people? You can't have your college kid go live in the garage. Or maybe you can.
Well, you can. Wouldn't be the first time. But get away from the parents.
Yeah.
But it was really amazing today about the CDC announcement telling students not to leave school and to stay at school. I mean, that was really bold. I'm pleasantly surprised and happy that the CDC has got some teeth in it, some of their guidelines. People should not be moving around now. It's out of control. Look at the deaths. How many deaths today? 168 deaths yesterday, and 14,000 new cases. I mean, it's just spinning out of control. But everybody has to stop.
If your student can't stay at school, the dorm's closing, do you just keep them in their room for a week or so?
Well, unfortunately, if that is the option, yeah. I mean, they have to be isolated when they get back. It's that bad. I mean, I have canceled, I have my kids live here in Chicago, and they are not coming over.
All right, let's get to viewer questions. With so many asymptomatic people and people unaware that they had COVID, do people need to have an antibody test prior to taking a vaccine? Would taking the vaccine be harmful for these people?
Well, that's a good question because so many people have had COVID. If you have the antibody, presumably you don't need the vaccine. If you accidentally took the vaccine, even though you've been exposed in the past, probably it's not going to have an adverse event. But, there must be some data in this big group of 30,000 and 40,000 people who've taken these vaccines to answer that question. And I want to see the results that they have.
Next question. How will someone demonstrate they're in a high-risk group? Doctor note, does asthma and AFib count or taking certain medications?
Yeah, no, that's exactly how you would do it. A doctor would make a declaration for you, or you could take your medical record or whatever, and say, I have diabetes, which would be the number one thing. Any kind of heart disease, any kind of lung disease, any kind of immunocompromised state there's a whole list of who's high risk on the CDC website. And if you have any one of those diseases, basically if you have any chronic disease, you're going to be high risk. So it's not going to be difficult to document. People are not going to be being very nitpicky about that.
All right, next question. Any guess on how the summer of 2021 will look? Will we be able to have large gatherings with no masks?
Well, it's the summer of 2021. If everything goes as planned, with the vaccine to the general population rolling out in April, and people take it, you're going to see a remarkable decrease in the number of cases. When large gatherings will be allowed without masks and stuff? That's a good question. We don't know. It depends how fast all this goes and if it goes, basically on schedule. But it will be either third quarter, beginning of fourth quarter would be my guess that things will really get back to normal.
All right. Well, if you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again on Monday. Have a great weekend.
Thanks, Doctor.
Hey, have a good weekend.